MD News Network recently attended the Medical Group Management Association's annual conference in New Orleans, where our cameras focused on multiple healthcare information technology vendors. Here's what they had to say.
There's no doubt that a major wave of change is coming. As physicians start electronifying their data, they are going to be able to exchange that data more freely with hospitals, with lab companies, and which leads to, at the end of the day, better patient care in research and disease management. So it's not just physicians' lives that I think we're making better, but ultimately yours and mine. As we become patients and move towards cures of major diseases, the fact that we've allowed data to move so freely within the system will definitely speed up those results.
Well, again, back to my theme of industrialization, whether retail, banking, travel, all of us want to be more control of what we do and how we do it. For instance, when I flew down here from Boston today, I never really spoke to any of the airline representative. I went up to the kiosk, I figured out what plane I wanted, what seat I wanted, what time I wanted. I got the ticket, and the only people I really talked to were the folks in the security and then the person that was helping me in terms of getting me a nice glass of water when I got on the plane. I think healthcare is moving in the exact same direction. People are going to want to take more control of their healthcare for lots of variety of reasons, but most importantly because now they have the economic burden of healthcare. All of us now are no longer considered healthcare free. It's well beyond a $15 copay. All of us are spending a significant amount more of our own personal income towards healthcare. That'll make us better consumers, and that'll make healthcare a more efficient value chain, which will get me back to my point of a better industry for overall.
I think the ability to connect to all types of organizations within the healthcare ecosystem, I think that's going to be a huge area of growth. It's just necessary. I mean, that was always the original promise of HIT, was the ability to go anywhere and to take your medical information with you. The vision was so right, and I think the time has come for that to come to fruition.
Things are moving very fast, and I think from the aspect of fast, what you're seeing is a lot more people focusing on the patient. I can speak personally from a billing standpoint. People want to see how you can go and touch the patient from the time they walk out the door, knowing what they owe so they don't get a bill in the mail. I think that's something critical. I don't know if we're there as an industry yet, but I think it's a solution that a lot of people are talking about. One of the tenets we have as global healthcare is that we work and play well with others. We believe from a software perspective we need to be extremely good, if not great, at billing, revenue cycle, and the world around that. Inclusive with that, we offer technologies that support practice management from a scheduling, demographic, claim filing, super bills, et cetera, et cetera. But what we do self-admit is that we're not going to be any HR. We're not going to play in that world, and so therefore we have to be able to go work well with others. Right. So to that end, the world of standardization is critical to us to succeed, and it's critical for us to make sure we follow that mantra of being able to integrate and interface with other parties out there.
Well, I think ultimately that's the core of really what a personal health record is. So as a patient, I would possibly go across state lines, and so certainly my record should follow me. And I think that's where the technology that's being developed can support that challenge of transferring information, because certainly a lot of the EHRs out there are installed solutions. They're not cloud-based solutions. So at the core, the main thing that needs to be cloud-based would be the actual personal health information. And that's really the most important thing. And so I think the technology's heading that direction. It's certainly what we're doing. I think Intuit stands for, again, we're vendor agnostic in the sense that we believe that vendors should be interoperable 100%. And our hope is that that will not be an issue or a challenge, that vendors will play well, that they will certainly open up the doors to the data. Ultimately, again, who owns the data? The patient. They're the ones that we're trying to serve in healthcare. And so when it comes down to it, the government is doing the best they can to put financial incentives and then ultimately a stick towards making sure that vendors do play well. And everyone's optimistic they'll do so, but certainly I think the challenge is real.